Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek De Silva. Irritable bowel syndrome is one of the most common gastrointestinal disorders affecting as many as 20% of Americans. A new study by a local gastroenterologist is raising eyebrows by questioning if IBS even exists. He says it may be a blanket diagnosis for a condition that is very treatable. Here to tell us more about his study is Dr. Saad Habba, a gastroenterologist at Overlook Hospital in Summit. Also with us is Christine Labisi, a mother of two from Aberdeen, who is incorrectly diagnosed with IBS. Thank you for joining us.
You're welcome.
Dr. Habba, let's start with you. You are a traditionally trained gastroenterologist, and you're telling us that IBS maybe doesn't exist?
Well, that's true. My frustration with patients with IBS, diarrhea predominant IBS, has really led me to a point where I was concerned that we are missing something. These patients are coming up on and on with issues that we have been trying to address this. We're frustrated as physicians. Clearly the patients are also very frustrated with that. And that led me to believe that, you know what, we may be missing something here.
So you did a study,
yes.
And what did the study show?
The study is basically, I went back into my practice and went over 8 years of all the patients that walked into my office with IBS, diarrhea predominant, and found that if we take and work them up to a different level, to a deeper level, not accept the term IBS, we found that this is nothing but a collection of different conditions. And by addressing each condition on its own, we were able to achieve much better results and take away the frustration that both the physician and the patient has.
We're going to come back to that because that is a very important piece as to what exactly is that you found and what led you to this. Christine, so you were told you had IBS.
Oh, yes.
What happened? To give us your story from there.
Well, I was seen by many doctors for like over a course of 10 years, and basically no one could help me. They would just say, it's IBS, high fiber, do this, do that, and eat this, don't eat that, and see you in 6 months. And unfortunately, that wasn't a diagnosis for me, and I was unable to leave my home most days. And I have 2 children, and I was a prisoner of my own home.
So, Dr. Habba, she comes to you, she tells you, I've got IBS. First of all, why did you seek him out?
I actually saw him on a TV program on Mystery Diagnosis and said, wow, this woman sounds like me. I got to see this doctor. And I said, watch, he'll be somewhere far. I can't get to him. Yeah. Turns out he's right in New Jersey in my own state, so it was wonderful.
So, Dr. Habba, Christine comes to see you. Right. What did you find?
Well, I did the usual workup that we all do, the endoscopy, the stool analysis, the blood work, the x-rays and what have you. But then all of these have most likely been done before, and they were all indeed normal. But my study, original study, which is the syndrome that I described, actually went in further, and we studied the gallbladder dysfunction, because the pattern of the diarrhea that these patients have, which is every time they eat, they go to the bathroom. If they drink something, they may go to the bathroom, and they may have incontinence or urgency. This is related to the gallbladder dysfunction. The gallbladder is not working well. That's the problem. And that is similar to the pattern that we already had established in the past, which is when you take your gallbladder out, 10% of people have diarrhea after that. So I figured these patients that have been tagged with IBS probably have the gallbladder in place, but it's not working. So that's what I did. I studied the function of the gallbladder.
So you are calling this Habba syndrome.
Yes.
Usually a syndrome has associated signs and symptoms with it.
Right.
What is it that what these folks have?
They classically have diarrhea that is associated with eating and drinking. Every time they eat or they drink, they go to the bathroom. Right. Wherever they go, they have to look for a bathroom. It's called bathroom mapping. These symptoms get better when they don't eat. So as a defense, patients, and I'm sure Christine did, avoid eating when they're going out, because they don't want to embarrass themselves. So the pattern is very similar to what has been identified in the past as IBS, diarrhea predominant.
Now, so what do you do? How do you treat them? By the way, let's start with you. What treatment what did Dr. Habba do for you?
He put me on a medicine. It's a cholesterol medicine, and basically it has a bile neutralizing agent in it. I take one before each meal. I eat, drink anything and everything I want. I go wherever I want. I have no problems.
So what you're giving her is a bile sequestering agent?
Yes, it changes the characteristics of the bile, because bile can actually cause diarrhea when it is inappropriately secreted. Because the gallbladder is not functioning, the gallbladder is like a thermostat. It's a regulator. When your regulator doesn't work, then you have inappropriate amount of bile. So what we do is that we give them this medicine, which has well been established in the past, and it binds the bile, so it changes the characteristics, and it takes away the diarrheal effect of that substance.
Let me throw this out to you.
Sure.
What I have seen, I have always found that irritable bowel syndrome is a wastebasket term like fibromyalgia. We don't know what's wrong with you, so we're just going to give you a diagnosis. I'll tell you what I have done that has really worked. I have used probiotics and digestive enzymes.
Right.
The probiotics and digestive enzymes for people with IBS has had a tremendous effect and a tremendous resolution in my own practice. Thoughts on that?
I think that that's a wonderful thing, and now we're definitely thinking about this. We add this to our different therapeutic modalities. But the important thing is do not accept IBS as an entity and stop at that level. You have to take the patient to the next level and say, listen, if I cannot get this patient better with this diagnosis of IBS, there is something else.
So do you do a diagnostic workup, Christine? I mean, what kind of a workup was done? You said colonoscopy and all that stuff. But how do you then, do you do a therapeutic trial with this medication? Is that what happened with you?
Basically, I started taking it, and within 2 days, I was a totally different person.
So what do we do?
I stay on it.
Okay.
Yeah. Before we started, we had to measure the gallbladder function, which is a contractility test called HIDA scan or the SAD scan, a standard test in every radiological center. Once we established that this is abnormal, then we start the therapy, because that really is the cornerstone of the diagnosis of
So once the gallbladder function is normal, then you can go ahead and do this. Or abnormal, excuse me, abnormal.
Yes.
Then you can go ahead and start this.
Then you can go ahead and start this, because now you've really established the diagnosis of Habba syndrome, and the response is incredible. It's 98% response rate.
Fascinating. Thank you for the information. Christine, thank you for both of you for joining us. After the break,